Hi folks. If we are going to transform healthcare, we have to come to the recognition that our current structures and processes may not be what we need. We need to look at doing things differently. And what we've done here at the Brant Community Healthcare System is built on the idea that our form should follow our function. And if we're about providing the best possible patient experience, then we need to organize our structures to reflect how care is provided in our organization. So we've, in all intents and purposes, blown up the traditional structure that you see in many hospitals and gone to a value stream approach. Now, this has not been on a whim or a sudden inspiration. We've done some work looking at what other organizations have done. We've been reading about lean and how it applies to healthcare, and we've come to the conclusion that if we're going to drive out waste, if we're going to transform how we provide our care and services, then our structure has to be conducive and supportive and enabling to make sure that the structure itself facilitates the patient experience. So we've landed on having 3 clinical value streams in our organization: acute and transitional care, planned care, and episodic care. And around that, surrounding that, we have our supports and our enablers, things like finance and supply, knowledge and information support, people development, quality risk professional affairs, our care and support, which includes everything from DI, pharmacy, infection prevention control, and lab, to really support the 3 clinical value streams. Heading up each of the clinical value streams are the value stream leaders and medical co-leads. And that's been very important. We want to make sure that this is a shared responsibility. And through this structure then, we've developed and enhanced the roles of group leaders and team leaders right down to the front lines so that the entire patient experience in acute or in planned or in episodic care have someone who has a clear responsibility and have ways of engaging the people all along so that all the other supports come into play and the patient moves through a process that is smoother, that reflects how they want to have care and treatment provided, and that we don't make them come into our organization and our structure. We've changed our structure to better reflect how the patient moves through the system when they encounter it.
Yeah, when I first joined the leadership program, I was afraid to tell my colleagues, my friends, that I was taking the leadership program because I felt like I was stepping out of the group mentality. But having taken the program, because when you step out of it and you take the leadership program, you look back differently and you see how we were standing in the way of our own progress.
I think the emerging leaders really gave me the ability to seek out my inner courage and apply what I already knew I had inside, but just really tweaked those skills or brought to my attention skills that I didn't even realize I had. I also think the emerging leaders can help anybody really succeed in their niche. It helps nurture and develop whatever your passion is, and it's very applicable to any clinical area in the hospital. And I think any area at all that's even non-clinical, I think it would be worthwhile for individuals to take the course as well. I think that after I've taken the Emerging Leaders course, that it's opened up doors for me. It's opened up opportunities to meet different disciplines in the hospital. You network, you connect, you can develop your career through it. It's been a very positive learning experience. You build up other people's strengths as well. I can't say anything negative about the program at all, except for I wish it would just continue going on. I'd love to keep taking more and more and more.
The biggest takeaway was how different people have different thought processes, and I guess learning to wait until that person who might not think the same as me processes the information. It felt really wonderful being part of that program.
Mm-hmm.
It felt like somebody was investing in me, and it made me feel good about the job that I'm doing.
I found the training to be very beneficial as it showed me how I can be a better leader and initiate, take on, and move things forward without having official positional power within the hierarchy of the organization. It taught me to be very respectful to anyone I am dealing with in a professional and personable way. I also learned what type of leader I was and what my focus was in relation to process, procedure, and people. There was also a reaffirmation that teamwork is such an important method of working together and that collaboration is key to successful teams. I really recommend this training to anyone, whether they plan to move up the ladder in any organization or not. It was a very good and beneficial training.
I have to go into long-term care homes by myself and introduce myself and get buy-in and trust from staff. And I feel like I'm more confident doing that now than I was before emerging leaders. I guess knowing myself a little bit better has made it more comfortable.
It was a fun program, more than anything. I really enjoyed coming every time we had to come and learning and meeting new people within the organization that I don't normally get to deal with. So that was really, I'm a real people person, so getting to know people in different levels, I found that really interesting as well.
This course helped me to evaluate myself and my job performance that I do and support and encourage my coworkers with professionalism and respect. When conflict arises, I was given tools to use and proper communication techniques. Not that this is easy, but the resource was well explained and taught. I have an understanding of where the organization's going and that I communicate that better now. It's given me the language to communicate on everyone's level and keep a positive attitude going. People feel heard, I feel I'm hearing what people are saying. And I feel the leadership program has made me more sensitive to what the administration is, and it's actually made up of people like myself that are trying to move everyone forward.
Some of the lean processes and the asking whys of why is this issue happening, and not directing blame to people, but looking at the way the process works, the way the institution works, the way we've set things up to work, and when it's not working, it's not the individual's fault that it's not working, but that you can look at the process in a different way.
The people that facilitated it definitely are mentors. They're definitely people that you would want to aspire to be.
HR staff were there, the pharmacy people were there, so that the more people in the institution that have that same background understanding, the better things flow. That if you approach somebody and say, this doesn't seem to be working, whatever the issue is, what can we do to improve it, or is there a problem from your end that we're not addressing, and how can we do it differently, that people are coming from this on the same page to start with. And I think changes that are always necessary can happen much more smoothly. So the more people get through that program, and the more I think that change will happen more smoothly and to the betterment of patient care.
Well, welcome everybody. Thank you very much for coming out today and listening to us. My name is Laura. I participated in this rapid improvement event as a community member. And we just want to say thank you, and we hope that you will be as enthusiastic at the end of this as we have been all week to share this with you.
Hi, my name is Brenda, and I work in organizational development as a consultant. And on Tuesday, we started to look at the foundation of the house, and the poster is over there for those of you who haven't seen it. So the first thing that we talked about was 5S, and as you can see, the 5 S's stand for sort, set in order, shine, standardize, and sustain. And so one of the first things that our 5S group, which you'll hear from soon, got excited about was the laceration cart in the emergency room. So we wanted to standardize it with its counterpart in radar. So we got a hold of the cart, and the first thing we had to do was sort through it and figure out what really needed to be on the cart and how we could declutter it, set everything in order, making sure that everything that was necessary was there. And then we got out our Goo Gone and shined it up and made sure it was all sparkly. And then again, with the radar cart beside it, we were standardizing the different drawers and taking pictures. And then of course the most difficult part is the sustaining it, which we started by doing sending out an email and putting a yellow shadow box around where the cart actually belongs in the hallway, so that when people are through with it, they can return it to its home. And then because of the pictures in the drawers, they'll be able to make sure that the drawers look the same and that the supplies that need to be in there are there for the next person who needs it. So that was 5S. And then we went back and had some more fun with the dot shop. And so as you can see in round 1, as Jim was saying, the second team that didn't have me on it was able to do a little bit better with the 3 green check marks. And then we had to have a look at, as Jim was saying, what worked well. And we figured out that if we had more teamwork and had better cues for when we needed our supplies, and changed, originally we were all sitting separately, so we started to sit closer together, that we would do better. And we were very proud of ourselves. But as you can see, we didn't quite get it right yet. So we have more green still on the left side, but the right side started to catch on as well, and I had a lot more help the second go around. And so then again, we debriefed it and talked about what worked well and changed up our system entirely through the Plan, Do, Study, Act, and really learned from our errors. And I had a change in jobs. And all of that helped so that, as you can see, we have all green check marks at the end. And so that was a lot of fun.
So we kind of broke up. Elaine did the suture card, where she discovered there's another antiquated card that went along with it. I don't know if there's slides of that one.
Yeah, we got some good
Okay,
stuff.
almost ahead of it. Well, that's good. Okay. So what Leone and I did, we went into Zone 1, specifically Bay 2. That one is the one that looks at your trauma, your cardiac emerge. We try to keep that bay just for those critically ill patients that come through. And as you look at the forward picture, it's a lot of clutter, a lot of equipment that, you know, as multidisciplinary staff go in there, feel that they need, so they almost personalize it. So you can imagine, you know, 30, 40 staff personalizing one stall. It's a lot of stuff there. So using the 5S, you're able to sort it, pull a lot of equipment out, a lot of overstocking, a lot of redundant equipment, a lot of old, rotting equipment pulled out of there. So from there, we set it in order what we needed, and we broke it up into, from one side left. The left side became almost like all respiratory is what we created, and the right side was all what nursing needed, the trauma cart, and we broke it up that. So from there, we set in order what exactly we needed.
There we went into a session on brainstorming for the hiring and orientation, where we identified 90 areas for improving the process. And from there, we prioritized these based on the impact and effort, and then categorized them into waste communication visuals, standardization, and orientation. So I'm going to pass it on to Helena now, who's going to go over the waste communications and visuals.
Hi, I'm Helena, and I'm from the ICT department. At this point of the day, the team broke up into 3 groups, and the group that I belong to, we concentrated on waste, communication, and visuals. So what we did is we took each step out of the whole entire process, and we pulled out anything that may have to do with the waste or communication and visuals, and then we went and prioritized them. So our first one that we thought was the most important out of this whole entire process was the accountability of people who have tasks in the process. So we just found that there was a lot of waste within that section alone of people either waiting or trying to move things around, that there was just a lot of waste there. So the approval process for a new position, out of all of the tasks that we had listed, there were some that we could remove, there were certain sections that we could condense, and there was a couple sections that we actually reduced down to 50% of what they were. So there was a lot of effort that we could do there to shorten up the process. Then between the hiring manager and the HR, the creation of the job description and the posting, we found that in future state, if we created a screening criteria and standardized that once again would save up some of the wasting time.
The next area that we looked at was the actual creation of the employee file. It begins as a paper file, and it has to be turned into an electronic file within Meditech. We take this information and it goes through several people on the HR team before it flows through to payroll. We identified many different areas where there were people with different tasks to complete, and it was kind of going back and forth. So the HR core team is going to review their tasks and look at operator balance and try to distribute those tasks more evenly to get a better flow. We also identified that much of the information was being photocopied in HR and then sent up to payroll. Because there are many tabs in the electronic employee file, and you may need to review information on one tab and then be toggling back and forth and inputting information on another tab. So we've already identified an improvement that we can make is to have dual monitors for payroll and HR staff. And they will be able to have one monitor where they can review the information and be inputting it on the other monitor and eliminate the need to have a paper copy in front of them that they're inputting.
Some of the delays in the process are signing off of electronic PAFs. What we'd like to implement, the recommendation here, is to have it as leader standard work. Every day in your calendar, put a note in there from 8 to 8:15 to check your Meditech tasks. So when you're here every day, you know to go in, sign them off, and that won't stop the process. If everyone does it, it'll just keep progressing down the line. And we're going to, we attended the clinical managers huddle, and we're going to go to the SLT operations huddle as well, just to further educate on that.
We also identified a need for a trigger for known strategies or shortages to expedite the external posting.
Hello, my name is Barb, and I work in the ICT department. So what we did, based on our brainstorming with a larger group, we took the issues, and rather than tackle one at a time, we hopefully incorporated it into a new orientation schedule that not only outlines and addresses some of these concerns, but also create some standard orientation process.
So our team would like to thank everyone for coming here this afternoon.
Okay, good afternoon. I'm Angie Fraser. I'm one of the nurse clinicians. I'd like to welcome everybody to the Code Blue Code Paint Rapid Improvement event. We're a group of professionals that got together to really examine our Code Blue and Code Paint process over this past week. And we came together with 194 years of combined experience.
What we actually did was we took a video of a mock code that was done earlier in the year. We used that as a tool to identify some of the key areas that we need to work on this ride. So we're going to spend a couple of minutes and actually show you a clip of that video. So we can see in this video the Code Blue's already started, the team members have arrived, they're performing the Code Blue. And if you can, pay attention to where everyone is and how they're doing their job and what it is they're doing in their function.
have a parent training. We have an idea of the advisor to start. We have our president in mind. So we're going to have these things here. We'll do it on the checklist.
Go move back.
Alright, so what do you think, guys? Are you happy? Yeah, we're going to Alright, so let's meet you guys. You want to check? Someone's not going to We had Ross and Debbie as well. Okay, so
So you can see the video is a very great tool for us to see what goes on, whether it's mock or not. When we looked at that video, it was very clear, we identified there was very clear deficiencies within our code blue process. Just very quickly, we broke it down into very small areas that we could start to work on so we can focus the rest of the ride. We identified there's a deficiency with the code card itself, where it's placed, who touches it, who gets at it. We also identified that we need some clarity in some roles and deficiencies within the roles in the room and where everybody was. We also discussed the location. One thing that came up with that room is very large, much larger than the majority of places that a code takes place in. And even in a larger room, it was quite compact. And the last piece we noticed was there was deficiencies within the policy, discrepancies between a code blue, code pink, and so on. We also spent the rest of the day reviewing 5S. What was very interesting is we discussed applying the 5S not only to the physical, like the cart, like a location, but we also discussed using the 5S to discuss and increase efficiencies within the processes that were in place.
If you just want to have a look, this is our current hospital code cart that does respond to all the codes in the hospital. As you can see, it's a mess. I don't know if you could find what you needed in an emergency, but probably I don't think I could. So the next picture just shows when we use the 5S principles, how much we actually pulled out of this cart. So pretty staggering amount. Extra supplies, a lot of dollars in inventory. I'm sure there's some waste in there. So this is our new cart here, if everybody wants to have a look at it. We've tried to clean it up, we've tried to group things together to make them into components so that it's easy for the user. They have everything that they need. It's easy for the user during the code, but it's also easy for the user at the end state when it needs to be replenished because it's, here you go, let's open it up. So in the top, we have a tray full of medications. In our next drawer, we have more medications. We also have the supplies that are needed to administer those medications. So they're all components. When you go to restock this cart, you make sure that you have trays 1, 2, 3, 4. Your first couple drawers are full. So we've also grouped it by what you would need in terms of supplies. So all of our defibrillation supplies and our blood pressure covered in this drawer. We've got a pediatric drawer. Everything that's needed for a code pink or a code blue pediatric is in here. There's medication, there's supplies, there's intubation equipment, everything that you need. Take this box out, use it if that's the case. In the very bottom of the cart, we have got our airways box. So again, sealed boxes. We know if they've been used or not. This is meant that this box is to be handed to the RT at the head of the bed. They've got what they need. They no longer need access to the cart. They're not saying, can you pass me this? Can you find me this? They may be asking somebody for something that they don't even know what they're looking for. It's all self-contained. Along the side of the cart here, we've got supplies to start an IV line. So you could have a nurse priming an IV line that's not right in the middle of the action, but they don't need to be right in the middle of the action. The defibrillator has been mounted on a swivel arm so that it doesn't matter where this cart sits, whoever needs to see it can see what they need to see. We've got all our PPE equipment on the back of the cart. We've put a sharps container up here. It's large enough for anything that needs to go in there. Before there was one that was too small, and really what's the use? We've moved the suction down here. It can be unhooked from the cart, again, handed to the respiratory at the top of the bed where it's needed. I don't know if you noticed in the video, but there were a lot of people fumbling in this cart. You know, it's hard, it's very small spaces. And, you know, to say, oh, excuse me, pardon me, I need to get in there. At one point I counted, there was 3 people trying to get into the cart at the same time. We've tried to compartmentalize so that everything that you need is there. And take your piece and go.
Andy, help! Pushing the code blue button, the and on. Help, code blue! I got the airway box, I'm a second responder.
Can you email that to Ron?
Hi, I'm Angie, I'm the RT. I'll take over the airway. Hi, I'm Charlie from Critical Care. How are we doing with construction? Do we need to change? I think so.
I'm Carol from IV. I'm here to start the IV.
Hi, I'm Sky from Emerge.
Mark, can you record?
Yes, I'm the recorder. I'm the doctor from ER. I stand here.
I'm Brian, the ESA, to pass out PPE equipment.
Excellent.
Thank you very much, everyone, for taking the opportunity to spend some time with us. We appreciate being part of the opportunity to make changes in our hospital. We hope that we've had some insightful suggestions and changes that will help to advance our ever-changing healthcare system. Thank you to our facilitators, Carla and Marnie and Tanya. Thank you very much for the day. As a team, let's go from good to great!